Okay, we're back with Maddie, and since she was having issues with her neck and saying she had some neck pain, we sent her to neuro, and we're gonna test her 12 cranial nerves first. The first nerve would be the olfactory nerve. This is the smell. So I'm just gonna close one nostril, and I'm gonna ask you to smell something.
Okay, I'll close my eyes.
Yeah, just to smell. Can you smell this?
Smells like deodorant.
Really? What about this side?
Still smells like deodorant.
So it's fine. She still has a good sense of smell out there. Next, we would also check her optic nerve. To do this, since this is a cranial nerve too, optic nerve, you would use a Snellen test, and you would have her stand 20 feet away from a Snellen chart. And if she can see from that far away, she has perfect vision, 20/20. But as she gets closer or farther away, the sight number varies. Then we don't really have a Snellen chart, so we're just gonna skip that. Next, we would also check the cranial nerves 3, 4, and 6, because you can do those basically at the same time. And you would do this by, first I would have her a light shined. So I would have shine a light right in this eye first to check and see if this other eye constricts the same way. Okay. Next eye, sorry, blinding me.
Cool.
Okay, her pupils are constricting the same way at the same time. Then I do the reflection test. And both her eyes constrict at the same time, and they reflect it the same way as well. And that's really important. Now we're going to do the confrontation test. If you don't mind standing up.
Oh, sure.
Sorry. Okay.
Oh, I guess I can move that so you can say.
Okay. If you can cover your eye with this one eye, and I'll cover this eye. And then just tell me when you see my wiggling fingers.
I can see them.
Just don't move your eyes.
Okay. Yep, I see them.
Okay. Now the other eye.
I see them. Sorry.
I know it's fine.
Yep.
Okay. So that was that's 1 year ago. Thank you. All right. We would also check. So that's how you check her pupils to make sure they're both dialing correctly, because if there's not, there's most likely a problem with that nerve. And then the next, you would also check you would do the cardinal positions. So you just follow this with your eyes, not with your head. Don't
Okay.
move around, so. Okay. So her eyes, she has a good following and range of movement there. And then the next one we would test would be the trigeminal nerve. And to do this, I would have her grind her teeth and bite. So I'm going to feel her here. Can you grind your teeth and bite? Okay. So that nerve's working pretty well, I see. Okay. Next is going to be the sensory test as well. And to do this, I'm going to have her close her eyes, and I'm going to touch her forehead, cheek, and chin, and she's going to tell me when she first feels it. So can you close your eyes, please?
Sure.
And just let me know when you first feel this.
I feel it. I feel it. I feel it.
So she has a good sensory nerve is working very well as well. And to check, and then the next test I'm going to do is test her facial nerve. So can you raise your eyebrows and puff out your cheeks? Okay. And that's the cranial nerve number 7. And she's fine there, and she works just fine. And the next nerve to test will be cranial nerve number 8, the acoustic nerve. And I'm going to cover her ear and say a word, and she's going to repeat it back to me. You usually say a word that's kind of fun. So, can you cover this ear, please?
Sure.
Okay.
Vacation.
Okay. Other ear, please. Can you cover the other ear?
Mm-hmm.
Oh, you did.
Christmas.
So she can hear as well. So then the next test I would do would be to check cranial nerve number 9 and number 10, the glossopharyngeal nerves, and that's to test the gag reflex. And to do this, I don't have an actual,
Tongue depressor?
Tongue depressor, yeah, that's the word I'm looking for. To put down and put it on her tongue and to hold down. But to do this, I would hold that down on the midline of her tongue and have her say ah. And that's to just make sure that she's, she can gag, and that's a good reflex to have. Always.
Yep.
She's bulimic, The vulva should go up and down equally, and yeah, That's it. And then I would check the next nerve would be cranial nerve number 9, the spinal accessory nerve. And to do this, I'm going to press down on her shoulders and have her lift them. Good. Now move your face that way. Okay. And against that. So she can push against my face very well, or my hands very well. And that shows she has a good sense of movement and her spine's working correctly. And there's no dysfunction there. So that's also very important since she has had a sports injury to check for. And then for cranial nerve number 12, the hypoglossal nerve, this is to inspect the tongue. And I'm going to have her say light, tight, dynamite.
Light, tight, dynamite.
Okay, and that shows that her tongue is moving correctly, and she's not really, it's a tongue twister a little bit, but she can still say it, and there's no neurological problem there. Okay, the next part of the neurological test I'm going to do will be the cerebellar function, and I'm going to have her do the tandem walk. So this is to do the head, heel to toe, and she can't fall down while she's doing this, so heel to toe, please. If someone was drunk, this would be a problem.
Good thing I'm not drunk.
Okay. So she's fine there. And then the next I'm going to do the Romberg test. And that, I'm not going to have her stand for 20 seconds, but she has to stand for 20 seconds with her feet together and hands at her side and just basically stand there without falling over. If she did that, there would definitely be a problem there. Usually, again, people who are drunk cannot do this because their mind isn't functioning correctly. And then the next I'm going to do the rapid alternating movements. So if you move your fingers like this, touch your finger to your thumb as fast as you can. I can't even do it correctly, but it's fine. And then you would also have her, I would have her sit down and touch your hands to your knees like this. And this just shows that she has a good sense of movement and her that nerve is working well, and she's not like slow to move on that. And then the next would be the kinesia position. I can't even pronounce it. And that's when I'm going to move her. You can do this with a big toe or a finger, and she has to tell me which position or which direction I'm moving her finger. So, close your eyes.
Up, down, up, down.
So it works there as well, and that's important to do. And then the next is the stereognosis test, and that's when I'm going to put an object in her hand that she would be familiar with, and she has to tell me what she's holding. So, if you can close your eyes, please.
Okay.
Okay. Can you tell me what you're holding?
Is it a dime?
Yeah, penny,
No.
same thing.
Close enough.
She knew it. Basically, it was like a coin. It was in that. And then the next would be the graphothesia test, and this is when I'm going to write a number or a letter in her hand with her eyes closed, and she can identify it. So.
I'm sorry, can you do that again? Or do an easier letter?
Yeah, maybe that was a hard letter.
B?
There you go.
Okay.
I did A the first time, but that was
Oh, that was hard.
That wasn't the smartest thing to do, probably. And then the next thing I would do would check her reflexes. So you can sit on the bed.
Sure. Okay,
Yes.
we're good.
And I'm just going to test that her knee moves correctly, and then I'm going to hit it in the right area, and she's supposed to kick her leg out fast. So.
Can you see it?
Yeah. I'll do it again just to make sure you can really see. She saw you like kick it. That was maybe the best area, but a quick hit. And then to do the next thing you do would be the curve the toe. So I'm gonna write a J on your foot, and you're just gonna see how your foot reacts to that.
Ugh. Sorry, that feels really weird.
It's fine. And that is basically it for the neurological assessment.
Awesome.